Hello, my name is Michaela Blackstock, and in this video, I will be presenting the epidemiology and control of HIV in New York City. The topics that will be covered in this video are the background of HIV in New York City, the history of the outbreak in New York City, methods of surveillance for HIV, the demographics of HIV within New York City, the epidemiology of HIV in New York City, the predominant risk factors, as well as current and recent prevention measures, barriers in controlling HIV, assessment of effectiveness to control the HIV outbreak, and a prevention strategy. New York City continues its ongoing fight against the HIV/AIDS epidemic. According to the United States Census Bureau, New York City covers about 300.4 square miles with a population of 7,088,121 people as of 2023. The city is divided into 5 boroughs: the Bronx, Queens, Staten Island, Brooklyn, and Manhattan. In New York City, the median household income is recorded at $70,663, which is in line with the national median household income, and 17% of its population lives below the poverty line. Citizens aged 16 and older amount for 63.4% of the labor force, and 83.2% of the population 25 years or older graduated from high school, and 39.6% have earned a bachelor's degree. Unfortunately, 7.9% of the population 65 years or younger are without health care insurance in New York City. In July of 1981, signs of the outbreak started with 41 reported cases of Kaposi sarcoma in gay men in New York and California. Kaposi sarcoma is one of the main types of cancer that we now know affects individuals with HIV. The New York City Department of Health reported that from 1981 to 1990, it reported 37,436 cases of AIDS were also diagnosed. During this time, there were consistent reports of incidents and cases related to men-to-men sexual contact. There was an initial rise in cases of injection drug users and women through heterosexual intercourse as well. Currently, New York City has experienced a 14% increase after 20 years of a consistent downward trend as a result of a resurgence of HIV testing after the COVID-19 pandemic in 2020. According to the New York City Department of Health and Mental Hygiene, despite a 14% increase in new HIV diagnoses, the new number of HIV diagnoses is still 8% less than what it was in 2019. New York City is a large urban area home to some of the more diverse populations. Surveillance data are collected by specialized New York City-based HIV testing laboratories under orders of the New York City Department of Health and Mental Hygiene to confirm the dates and facts of diagnoses and determine whether the report represents a new or existing diagnosis. Surveillance was conducted by reporting the number of new diagnoses of HIV based on gender, age, ethnicity, race, borough, poverty level, zip code, transmission type, and deaths from HIV. As of 2021, there are reported 100,594 people living with HIV in New York City. As of 2020, the rate of people living with HIV per 100,000 population was 1,459 people. The estimated rate of new HIV diagnoses per 100,000 population was 20. And the reported number of deaths of people living with HIV in New York City was reported at 1,766 deaths. The epidemiology of HIV differs among the boroughs as each area has its own diverse communities. As depicted in the table below, provided by the New York City Department of Health's annual HIV surveillance report, the Bronx accounted for 23.3% of all HIV diagnoses in New York City. Brooklyn has the highest prevalence of HIV compared to the other boroughs, accounting for 26.1% of all HIV diagnoses. In Brooklyn, men had the highest number of cases compared to women and transgender, with 330 newly diagnosed HIV cases in 2021. The mortality rate in Brooklyn is 9.1 deaths per 100,000 people with HIV. Manhattan accounts for 19.3% of all HIV diagnoses. Queens accounts for 18.5% of all HIV diagnoses, and Staten Island has the lowest prevalence of HIV, accounting for 2.5% of all HIV deaths in New York City. The mortality rate of HIV in Staten Island is reported at 8.2 deaths per 100,000 people with HIV. The HIV prevalence rate ratio by race/ethnicity in 2020 was 44.2% in Black individuals compared to 37.2% in Latino individuals, 11.7% in white people, and 5.7% for Asian/Pacific Islanders. The rate of Black males living with an HIV diagnosis is 3.3 times of white males, as shown in Table 2. The amount of Latino males living that are diagnosed with HIV are 2.3 times higher than white males who are also diagnosed with HIV. The number of Black males diagnosed with HIV is 14.8 times higher than white females also diagnosed with HIV, and the rate of Latina females living with HIV diagnosed is 7.5 times higher than white males. The HIV diagnosis rate of Black males in New York City was 1.5 to 5 times higher than males from other racial groups. The HIV diagnosis rate for Black females was anywhere from 2 to 9 times higher than the rate of females from other racial groups as depicted in Figure 1. So, as mentioned in the previous slide, Figure 1 depicts the HIV diagnosis rate per 100,000 New York City residents by gender and race or ethnicity in 2021. So this graph shows that HIV diagnosis rate of Black males in New York City was 1.5 to 5 times higher than males from other racial groups. The HIV diagnosis rate of Black females was anywhere from 2 to 9 times higher than the rate of females from other racial groups as depicted in Figure 1. The modes of transmission for men and women in New York City are injection drug use, heterosexual contact, male-to-male sexual contact, transgender people with sexual contact, and prenatal transmission. The most predominant mode of transmission among people living with HIV in New York City is male-to-male sexual contact with 46.9%, which means almost half of the HIV diagnoses are among men. The second most mode of transmission with 32.3% is categorized as unknown, as shown in Table 3. Once HIV is in the body, the virus stays in the body for life. In order to prevent HIV, there are several safety practices that can be followed to decrease the chances of HIV infection. Many prevention methods involve proper education on the risks of HIV and strategies to reduce the risk of getting HIV. For example, the emphasis on using condoms or dental dams properly whenever having vaginal or anal sex, avoiding drug use and sharing injection needles with others, and avoiding open cuts and sores coming in contact with HIV infected blood, semen, and vaginal fluids. Getting tested for HIV is a critical step in preventing the spread of HIV. People can be living with undiagnosed HIV and don't even know it. It is important to get tested for HIV in order to protect yourself and your partners. If an individual is in a relationship with a person diagnosed with HIV, they can take pre-exposure prophylaxis or PrEP in order to reduce the risk of getting HIV prior to exposure. Individuals living with HIV can take PEP, an HIV treatment to reduce the symptoms or viral load of the disease. Abstinence is the most effective in preventing the spread of sexually transmitted diseases such as HIV. Currently, as of 2014, New York State launched a plan called End the Epidemic, with the goal to end the AIDS epidemic and decrease the prevalence of HIV by 2020. The three-point initiative includes identifying individuals with HIV who are still undiagnosed and connecting them to healthcare, while also linking and maintaining persons diagnosed with HIV in healthcare to minimize various suppressions so they remain healthy and prevent further transmission. The program also facilitates access to PrEP for high-risk individuals to keep them HIV negative. In an effort to reduce the spread of HIV, New York City must overcome the barriers that prevent the ending of the HIV epidemic. The primary barriers are associated with three main factors. One significant barrier is addressing social factors like the stigma and discrimination against HIV due to fear and misinformation. Historically, individuals with HIV were considered socially unacceptable, with people thinking that people with HIV deserved to have it because of their poor choices and believing only specific groups could get HIV. There are also HIV discrimination, like people refusing to touch people living with HIV and healthcare providers refusing service to people living with HIV. This results in feelings such as fear and shame that can deter people from getting tested for HIV. A second factor is barriers within the healthcare system. For example, a study determined that factors such as long waits for provider appointments that require a positive confirmatory test before scheduling an appointment, system navigation, and disrespect for patients make it difficult to ensure quality HIV healthcare. A third barrier involves providing care to people living in high-risk populations. Examples for people who experience homelessness, people with mental illness, and people who suffer from substance abuse are considered high-risk populations. Racial and social economic disparities have been shown to affect access to healthcare a community has. A study in 2014 found that Black individuals living with HIV in the most impoverished neighborhoods had the lowest proportion of viral suppression compared to white individuals living with HIV in the least impoverished neighborhoods. When it comes to HIV, the proverb, an ounce of prevention is worth a pound of cure, is quite fitting. The creation of an interactive HIV preventative program starting in middle school through high school that educates teenagers 13 to 18 about the risks of HIV and debunks the misconceptions about HIV is an effective method of reducing the prevalence of HIV and AIDS. This program would also provide young adults with the opportunity to speak to individuals with HIV and AIDS and learn about their experiences living with this disease. Eliminating the stigma surrounding HIV will help empower individuals to take control of their sexual health. And here are my references. More references. Thank you for listening to my presentation, and I hope you have a wonderful rest of your summer.